Hi, I'm Dr. Amelia. It's nice to meet you. So, what's been going
Okay.
on?
My name is Dr. Adam. Nice to meet you too. So, how
So,
are you doing? I hope you're doing great.
so how?
Can you?
Sorry.
Yes. Yes. I'm hearing you.
9:21
Okay.
a.m.
So, what's been
Okay. Can you
going?
see a patient? Can you see? Yeah. Can you see a patient clearly?
Yes, I can.
Okay, that's good. So, Dr. Amelia. So, how are you doing?
I'm good. How are you?
I'm fine. I hope you had a good breakfast.
Yeah, I did.
That's good. Um, kind of have a splendid voice, or a more of a melodic voice.
I'm sorry. Say again.
I say you have more of a melodic voice. Can you hear me?
I'm sorry. Can you say that again?
Okay, I said you have a sweet melodic voice.
Oh, thank you.
Okay, so what's good?
All right. So, what's been going on?
Okay, well, I can see you can see a patient, a beautiful patient before you.
Mm-hmm.
So, do you want to know anything about your patient?
Yeah. So, what symptoms have you been having?
Yeah, she's been having abdominal pain,
Okay.
fever.
Okay.
She's having loss of appetite.
Mm-hmm. Okay.
She's having some diarrhea.
Okay.
Yes.
Have you had any weakness?
Yes, she is not really weakness per se, but slightly.
Okay, so can I see the temperature of the fever?
Okay. Yes, the temperature was done. Okay, which are you conversant with? Are you conversant with degree Celsius or Fahrenheit?
Can I have it in Fahrenheit, please?
No, what did you say?
Oh, I'm sorry.
Okay,
What?
okay,
Okay.
okay. Which are you conversant with? Temperature in degree Celsius or in degree Fahrenheit?
Can I have it in Fahrenheit, please?
In Fahrenheit? Okay. So
Yes.
our temperature is
Oh, I'm not sure.
97. Our
97.
temperature is. Can you hear me?
Yes, I can hear you.
Yeah, our temperature is 97.9 degree Fahrenheit.
Okay. So,
Yes.
is the abdominal area tender?
Yeah, the abdominal area was tender.
Okay. So, have you eaten in any food vendors recently?
Uh, yes, recently, yes, okay, yes, she has been doing that.
Okay. So, my belief is that you might have typhoid, which is just a bacteria of potentially salmonella.
Yes.
It's an endemic in Europe, South America, and Africa. So I'm going to
Yeah,
want to run a
yes,
culture on you, and
yes,
can I also do an RTD just to take out
yes,
malaria?
to rule out malaria. Yeah, that's good, man. I like the way you're going. Yes, you are going in a perfect way because you don't. When a patient comes to you, don't just really make just one diagnosis. At the end of the investigations, the diagnosis can fail to another thing. You may be thinking of something, but the result of the investigations will show you that okay, yeah, no, this is what you have. It's not what you were thinking. But though it's good to have a clinical diagnosis, as just like what you're just doing now. Okay, so you want to do a blood culture? Did you say? Did you say blood culture, or what kind of culture did you say?
Yes, a blood culture for typhoid and an RTD just in case of malaria.
Yes. Okay. So what do you want to know about with these investigations?
Okay, so
So the investigations is done for the patient.
okay, I'm sorry. Did you get the cultures back or?
Yes, the culture. Yes, we are able to get positive culture.
Okay, for typhoid?
Yes.
Okay, so considering you have typhoid, I'm going to want to give you an IV antibiotic. It's
Do you have a specific IV antibody you want to give her?
oh I it's
Okay.
an artisan Nate, I'm pretty sure. I'm not sure how to pronounce it.
Okay, I'm not sure of the antibiotic to give. Yes, because I can say that any IV antibiotic you give to a patient with typhoid, most likely going. So you can think of so many of them. There are so many IV antibiotics, but just leave that. Let's leave that for now. So let's go on. Yes.
Okay, so for prevention, I'm going to want you to keep a good hygiene, and I want you to be very sanitary, and I'm going to want you to stay away from food vendors for a while because they hold a lot of bacteria that can be very harmful.
Yes. Okay. Well, okay. What do you advise her about what she takes, orally?
Okay, so it'll just be an IV antibiotic. It's not a big deal. It's just an oral IV. So.
Yes, but sometimes really you can give an IV antibiotics, but then when the patient can tolerate orally, if the patient is vomiting, if you give the patient oral medications, the patient will vomit it out, and then you don't get your clinical result at the end of the day. So, but then if the patient is not vomiting, you can take oral antibiotics, for a period. Do you know how long you treat typhoid?
I'm not sure.
Okay, you can treat typhoid between 10 to 14 days.
Okay.
Yes. Okay, can you hear me?
Oh, yes.
Hello? Yes. Okay, so when you talk about prevention, you've made some preventive tips, for typhoid. Is there another preventive measure you will want your patient to know?
Oh, yeah. Just stay in a hygienic area, and that's very sanitary, and stay away from food vendors, and
yes, of course. And of course, there's some food stuff that if she's going to really eat them, you have to cook them. You have to cook some food. Sometimes it's better to take something that is hot because you most likely feel that it is going to be free of bacteria, isn't it? Yes. Normally, it's just like when you're taking fruit. There's a saying that said that if you cannot peel it, you don't eat it, because if you see maybe a fruit that is already been peeled, why should you eat it? Because you don't know maybe it has been contaminated. It's just like if I'm going to give you a banana to eat now, if I give you unpeeled, or rather when it is already peeled, what do you think? That means it must have had some contaminants. But when it is given to you unpeeled, and then you have to peel it yourself, you are most likely sure that it's going to be clean. So at least that one way or the other, you've already prevented your typhoid fever. But okay, yes, your typhoid. Do you know any other name for typhoid apart from calling it typhoid?
Oh, I'm not sure. What is it?
Yeah, you can call it enteric fever. You can also call it salmonellosis. Because why it's called salmonellosis? Sometimes because the organism responsible for typhoid is salmonella. You get it? Yes. Well, you're really doing great. You've tried so much, and I believe, with the symptoms I've given you, and you're able to make a diagnosis, that means you're really doing great. That means if you see a patient with such symptoms, you can almost make a good diagnosis, make good investigations and treatment. So you're really done great, and keep it up.
Thank you.
I believe you do better than this. Yes. So is there anything you want to know, or is there anything you want to tell your patient?
Oh, I was just wondering what her name is.
Yeah, what do you say? Hello? I didn't get you.
Oh, what is her name?
Yes. My name, I'm Dr. Adam.
Oh, no, the patient's name?
The patient's name is Zainab Musa Abdul Rashid. 3 names, I'm giving you 3 names. Zainab Musa Abdul Rashid.
It's really nice to meet you.
Thank you so much.
Thank you.
So, yes. So, you don't talk to your patients? Can you see her so that at least she can see she's smiling, isn't it?
You have a really pretty smile.
She's happy that that you made a good diagnosis. She's saying hi. You saw?
Yeah.
Okay, so that's good.
So I hope the treatment works.
Yes, it's already working. We commenced treatment and how she's working. She's getting better than the time she came initially.
So it's been really nice to meet you, and I hope you're feeling a lot better and you get in really good health. So
Okay.
I think that's all.
Yes. Okay. So have a lovely time.
Bye. Thank you.